to do an IV start, you would want to make sure that you have orders from the provider to see what type of or what size IV you might need. So after I do that, I would want to go gather all of my supplies, which I have an IV start kit. I have a 20 gauge needle, and then I have my J-loop and saline to flush with. After that, I would want to perform hand hygiene once I walked into the patient's room, and I need to identify their name and date of birth, and then I would want to begin to look for a vein and palpate. So there's a good one right there. After that, I will put on my gloves. And open my supplies. After I've opened everything, I just want to prepare it. So I have my tourniquet, and on a real person, once you've found your vein, you would want to apply the tourniquet 3 to 4 inches above where you're gonna do your insertion. Obviously on here I can't do that. Okay. Once I have that done, I'm going to go ahead and take the lid off that, and lid off this. And I would want to prime my J-loop. And this end needs to stay sterile, so I would leave it in the pack. After that, I would take my antimicrobial solution and clean the area from inward to outward, and then let that dry. Once that is complete, I'm going to take the cap off my needle, make sure that the bevel is up. You want to pull the skin taut and go in at a 10 to 15 degree angle, and make sure that you warn your patient of a stick. And then once you see flashback, you would want to go ahead and make sure you have the catheter inserted all the way, and take your pinky and put pressure and hold the catheter steady, and you would pull and release the tourniquet and pull the needle out. Put it in your sharps container. Going to go ahead and attach my J-loop. And make sure that I have secured my catheter down. And I will flush the IV. Once that is done, I will make sure to close my J-loop. Take this saline off. You would want to use the whole saline to flush and to secure my J-loop next to the catheter. And I would just want to make sure to note any type of redness, or if the IV insertion site might not be right, if there's any type of fluid buildup around it, anything like that. And then I would label and date and everything my IV. And after that, I would clean up all my supplies.